I think there are several challenges facing hematology these days. Blood transfusion is something that has revolutionized the care that we deliver to patients. So if we look at patients who have malignant disorders, when we give chemotherapy, we need to give them blood transfusion support. If we look at patients with sickle cell disease, they require regular red cell transfusions, as well as those with thalassemia. And then outside of hematology, we give blood transfusions to trauma patients and patients who have bleeding from other sources. Now, where the challenge lies really is to do with blood donations from ethnic minorities. The blood transfusion service that we have in the UK is phenomenal, and it's reliant on altruistic blood donors. But we're still short of blood from ethnic minorities, and actually, if we can get more blood donated from these populations, then we can actually match the blood or blood products that we give to these smaller, groups in our population. So that's one of the challenges, and we are trying to tackle that with various blood drives and public health initiatives. I think another challenge lies with research into non-malignant hematology. So traditionally, malignant hematology has developed quite rapidly in the last few decades, and that's because there's a lot of research and funding that goes into it. And I think what we're trying to do now is actually push a bit more research into non-malignant hematology to try to get that developing just as quickly. That's another challenge that we face, and the way we're tackling that is by promoting research at a more junior level as well. For example, we have HemeStar, which is a sort of registrar-led research initiative to get more research into non-malignant hematology. And I think lastly, one of the challenges that hematology faces is actually trying to inspire more junior doctors to go into that field. And I think education in the field, or giving junior doctors a bit more experience by giving them potentially rotations in hematology, might help inspire them to take it up as a career, to boost the amount of hematologists that we have for the future.